Mornings can be tough, even tougher if your partner wakes with kicking morning breath. However, jokes aside, killer morning breath can be a sign of different issues, including a sleep disorder. Your morning breath might be on the stout side if you're a smoker, have poor oral hygiene, breathe through your mouth, or if you have a breathing-related sleep disorder called obstructive sleep apnea, OSA. Continue watching to learn more about morning breath and whether OSA may be causing you or a loved one to wake with foul breath. What causes morning breath? 1. Dry mouth. Mouth bacteria breaks down food residues and dead cells, producing gas that causes your breath to smell bad in the morning. When you're awake, the constant movement of saliva cleanses the inside of your mouth and removes the odor-producing bacteria. During sleep, your saliva production decreases and your mouth becomes dry, allowing bacteria to grow and release a foul smell. 2. Poor oral hygiene. Poor dental hygiene is another common cause of morning halitosis. If you don't brush and floss, food particles can remain stuck in your mouth's crevices, releasing gas and a less than rosy aroma. Also, leftover food can form a sticky layer containing plaque on your teeth, causing infections and leading to periodontal disease. 3. Certain foods. Eating strong-smelling food in the evening, such as garlic, onions, and spices, can lead to foul breath the next morning. 4. Smoking. Smoking can produce an unpleasant odor in the mouth. Also, people who smoke are more likely to have gum disease, another cause of halitosis. 5. Medications. Certain medications, such as antidepressants, antipsychotics, and muscle relaxants, can contribute to dry mouth and waking up with morning breath. 6. GERD. Gastroesophageal reflux disease, GERD, or acid reflux, is a possible cause of halitosis. People with GERD may experience bad morning breath because of the backflow of acid from the stomach into the esophagus while sleeping. 7. Obstructive sleep apnea. Scientists have noticed a link between OSA and bad breath in the morning. OSA causes your upper airway to collapse and block the airflow. Consequently, you might breathe through your mouth while sleeping to increase the airflow, drying out your mouth, and leading to stout morning breath. What is obstructive sleep apnea? OSA is a common sleep disorder that causes pauses in breathing while sleeping. Those with the disorder wake up several times during the night, gasping for air or choking. OSA occurs because the muscles in the throat relax intermittently during sleep, blocking the airway. The most noticeable sign of OSA is loud snoring. Other signs and symptoms may include daytime sleepiness, waking up choking for air, morning headaches or sore throat, trouble concentrating, and daytime fatigue. The risk of developing OSA is higher if you're overweight, older, pregnant, smoke or drink, or have chronic nasal congestion. Keep watching because we're going to give you some tips on how to overcome morning breath. Tip number 1. Practice good oral hygiene. Brush and floss your teeth well after every meal and before sleep. Make sure you also brush your tongue. Also, using an antiseptic mouthwash can reduce bacteria in the mouth. Tip number 2. Don't smoke. Try to cut back on the number of cigarettes you smoke a day. That can significantly improve how your breath smells, especially in the morning. Until you manage to quit, avoid smoking at night and before you sleep. Tip number 3. Clean orthodontic apparatuses. If you wear a retainer, clean it well every day. As soon as you wake up, brush your teeth immediately to eliminate any remaining foul breath. Tip number 4. Chew gum. Research shows that chewing gum sugar-free preferably, can stimulate salivary secretion and reduce halitosis. Tip number 5. Periodontitis treatment. You will need deep dental cleaning if you have gum disease, periodontitis. A periodontist can remove the pockets full of odor-causing bacteria between your teeth and along your gums. Tip number 6. GERD treatment. Try taking an antacid medication before bed to reduce acid reflux during sleep. Tip number 7. Sleep apnea treatment. Sleep apnea might be the reason behind your halitosis. Consult a sleep specialist if you have halitosis and snore loudly or wake up at night because of breathing difficulties. Lifestyle changes can help treat OSA, including weight loss, exercise, quitting smoking and drinking, and changing your sleep position. Also, treatments for OSA include continuous positive airway pressure, CPAP therapy, adaptive servoventilation, ASV, oral appliance, or surgery. Treating OSA can improve sleep quality and help you get rid of snoring, mouth breathing, and dry mouth during sleep. Talk to your doctor if you suspect that you have OSA, or if your morning breath persists after incorporating some of the aforementioned tips. Help is available.